This episode of the Beauty Industry Podcast was brought to you by Murad Skincare Australia. Hello and welcome to the Beauty Industry Podcast, your online support community for the professional beauty industry. I am your host, founding director of Beauty Industry, Tamara Reid. Here, we are closing the competitive gap and speaking your language. This is a platform created and dedicated to the professional beauty industry, valuing community over competition. We serve to help connect you with inspiration from industry experts, expand your knowledge through educational pieces, and bring you the latest in product and technology innovation. This is Beauty Industry. Today our guest is Dr. Shyamalar Gunatheesan, founding dermatologist at ODE Dermatology, in conversation with Lashana Shepherd. It was whilst working with a particular professor of dermatology at the Royal Melbourne Hospital in 2003 which sparked Shyamalar's interest in dermatology. Since that time, Shyamalar has strived to place herself at the cutting edge of her specialism. Her interests lie in not just fixing the skin, but enhancing it, going beyond a purely pharmaceutical approach. Shyamalar seeks to utilise the entire gamut of options to improve skin health, including laser treatment and light therapy. She has received the highest of accolades for her research and publications, which feature in her specialist peer-reviewed journals. And having worked in Melbourne, London, and New York, Shyamalar has developed a breadth of expertise. Today, Dr. Shyamalar shares with us her love and passion for skin, why she has adapted her own approach to treating, and also shares with us some insights into treating some of our industry's most persistent skin conditions as a dermatologist. From ODE Dermatology, today we welcome Dr. Shyamalar Gunatheesan and Lashana Shepherd.
So welcome, Dr. Shyamalar. How are you?
Very well. Thank you for having me. It's something nice to do on a day of lockdown.
Yes, day of lockdown, a rainy, horrible day of lockdown. So it gives us something to do in the afternoon.
I know.
It's not fun being in Melbourne lately, is it? Between the weather and the lockdowns, it's not the funnest place to be.
I know, but actually today of all days, you know what? It's so gloomy. You might as well be in lockdown and just be indoors, curling up, doing a fun podcast.
Yeah, absolutely. And we're so happy to have you here. We start all of our podcasts by asking our guests how they began their career. How did you first discover your passion for everything skin?
Well, you don't wake up wanting to be a dermatologist, I say. So, obviously you start with med school, and as part of your 5th and 6th year rotations, you actually get to go into different departments in the hospitals. One of my rotations was in dermatology at the Royal Melbourne Hospital, and that 6 to 8 weeks really just kind of started my interest and this curiosity about our largest organ. So, dermatology, skin's our largest organ, and I have always been drawn to it because you're almost like this detective. You're having to look for what the rash looks like. There are 3,000 different skin conditions, and I've always been amazed at how you can pick it out just on distribution, type of scale, the color, different shades of red and orange. So I was really drawn to that. And we had amazing consultants and professors of dermatology that would teach medical students. That kind of collaborative approach to working out what was wrong with a person really drew me. And I've kind of been interviewed about this before, but for me, one of my biggest, you get moments of epiphanies or life moments. You don't always get it. But for me, it hit me when there was this patient who had this peculiar rash on her eyelids, and she had a bit of streakiness on her arms. And turns out that this condition is quite rare. And some of the junior doctors were kind of working out what it could be. It's not looking like simple eczema. They've done a biopsy. They weren't getting a clear diagnosis. And this professor in dermatology walks in and he just kind of blurts out the diagnosis, dermatomyositis, which is a very rare condition, but it can mean that there's something underlying in terms of cancers. And turns out this lady actually ended up having ovarian cancer. So it was just the idea that something on your skin could be an internal manifestation of something wrong going inside or something right going inside. That kind of that kind of skin internal body connect really drew me to dermatology.
That's fabulous. We always, I think even though we know it, we do forget that our skin is our largest organ. And it does showcase everything that's going on in our body. And yet for some reason, there are still people that go, oh, it doesn't matter what you eat and it doesn't matter what you put on your skin. But really it paints a picture of how you're going internally. There's things like jaundice and rashes and all these things that can show major health issues. So the skin is a very interesting thing.
It is, and I think there's a good amount of research to show that our skin's constantly, it's living, it's very permeable. 60% of stuff that we put on our face gets through our different layers of skin. That skin gut connection, the microbiome in your gut really correlates to what's happening on your skin. So my whole philosophy of medicine is to use modern medicine to its full advantage with all the therapeutic arsenal of drugs, but to also to awaken that internal potential of our body to heal. We, with the right changes in our diet, intermittent fasting, autophagy, we can actually turn on our stem cells in our gut. And I'm very interested in that kind of holistic approach to getting the best results for my patients.
Absolutely. And I was going to ask you about your holistic approach, because obviously with dermatologists, from a beauty therapist point of view, we have this idea in our head that no, they just throw medication at you, send you out the door. It's very hard and fast and black and white, but you don't like to treat that way. You're very much inclusive with aesthetics and lasers and LED light therapy and this holistic inside out approach. Where does this difference stem from? Is it a personal experience? Have you just noticed the difference when you use this approach?
I think a bit of both. Growing up, I was one of 3 girls to 2 parents who were GPs, but we were, always thrown into the world of medicine and Western medicine. But mum had a very kind of Ayurvedic, Chinese medicine background. So she loved to also, empower us with herbs and soups and things that are nourishing. So that kind of yin yang approach, I call it, seemed to work well for me. And then being a dermatologist, I felt that I love medicine because I can deliver the results quickly. But when my patients were after 100%, or, it's one thing to diagnose someone with psoriasis or eczema, give them a few creams. But the question that we all have as humans is, why do I have it? How can I make it better? What's my trigger? And I think if you don't address that, you're not going to get a long-term solution. So I would say it's really my patients that have pushed me over the years going, what else, Shani? What are you going to do now? And why wouldn't you combine all these bits of research and the arsenal of therapy to get the best result? So it's a no-brainer for me. And I think I like talking to people. I like being curious about what could be their trigger. Lifestyle is so important. I'm obsessed about the whole mind and body correlation. I think we almost need to detox our mind because that has so many implications for our adrenal glands, our stress levels, which then impact our skin.
Yeah, it's insane how many little legs this industry has. I mean, we're now talking to people in dental about how dental impacts skin and, again, how mind and wellness impacts skin. I mean, when it comes to things like LED, sometimes it's just that 20-minute chill out that's doing a lot of the healing, as well as obviously the lights and the wavelengths, depending on what we're treating. But it's that 20-minute downtime and the relaxation and just blood flow. We're looking at so many different avenues that we can go down to treat the skin now. It's not all one size fits all. And I agree with you. I think if we stop learning, our clients stop benefiting, and there's so much more information and avenues we can travel down now to treat our clients.
And we forget how bespoke we all are. We're such individuals, That's why you have to have this multi-pronged approach to get that sorted. If you had this cookie cutter method whether it's in natural or Western or just deep breathing and meditation, it ain't going to work. I think the magic is to really get your skin properly analyzed, and then work out what's going to work for you. But we're very lucky. I mean, it's not just me. I think a lot of practitioners are realizing the magic in combining all of these modalities.
It's becoming the wave of the future. It used to be very much, one facial. I remember when I was in beauty school, it was like you had dry skin, you had normal skin, or you had oily skin. There was no in between. Yeah. Now there are obviously all of these gaps that everyone is now starting to fill. And it's fabulous to see that we're going, okay, you can have a dry skin and a combination skin. So let's combine modalities to look at both, or whether someone has acne and rosacea. Obviously, we've got to combine two things. And obviously, there's also that internal external correlation as well, going, okay, this is what's happening externally, but we need to combine it with something internally to get you the best benefit. So combination seems to be the way that most of us in the industry are going. And if you're not there yet, you should probably be heading there.
And evolution, like the skin's not going to be stagnant throughout the years. We know our skin cycles differently throughout the months. So you just don't want to be literally stuck in your skincare, your attitudes, your mental well-being, your gut health. I think you want to be evolving. I think that's a good way of saying it. Yeah. Back to your point though about, how we used to categorize people according to skin types. It's just so much more. It's almost like your skin health has to be analyzed. You might have dry skin, but actually it's because you've got rosacea where your skin barrier is impaired, and that's why you're having a symptom of dry skin, but you need to treat the underlying condition. So that it's good. The awareness is out there, and I think the public is also so much more interested. And I always say, all of us have a budding dermatologist in us, because our skin's one of the organs that's so accessible. You can't just go in and check in on your liver with, whereas you can always check with your skin. Your skin can tell you a lot just from the way it's looking. I'm a firm believer that beautiful, healthy, luminous skin is genuinely healthy skin.
Absolutely. There was a study I read the other week that was saying that people that don't have enough sleep, apparently that appearance on their face, that darkness under the eyes, that sallowness in their skin can actually make them less attractive to people in social situations, which is quite funny because, we go, oh, you look a little bit tired, whatever. That's pretty normal, and probably most of us without makeup. But it's funny to see that even something like lack of sleep, which is so common, can have such an impact on even us in social settings. It does. It paints a picture of our health, how happy we are. It really showcases, like you said, dry skin. If you've got dry skin, it could be a myriad of different reasons, health concerns. It can be estrogen. It can be sitting in front of heaters. It can be lifestyle. It can be rosacea. It can...
washing your face, all of that.
Yeah.
But that was a very fascinating study. I love the bit on how just having less than 6 hours of sleep continuously, your brain, your perception of yourself changes. So you actually look in the mirror and feel unattractive.
Yeah.
So the stranger finds you more unattractive, but you actually, the chemical kind of receptors in your brain actually tell you that your skin's drier, it's more crepey, it's sallow. So that was, I think, fascinating, where they looked at the subjects and their perception also just changed. With sleep.
I found that fascinating, to be not only feeling unattractive as we do when we don't have enough sleep, but to be perceived that way. I was like, oh, okay, I need to sleep. I need to take naps. Something else in the industry, some therapists attempt it. I don't think they should, but some therapists like to try to attempt to look at their clients that are experiencing things like hair loss. A lot of therapists try to tackle it with things like LED and skin needling, and it's not really our forte. It's something that we can obviously hand over to someone like yourself to look into it further. What is your take on these kind of modalities for things like hair removal or treating things like alopecia or vitiligo or those more intensive skin concerns and conditions?
I mean, if it's hard, because I think once we start going into territories like autoimmune conditions like vitiligo, we've got tried and tested cutting edge therapies as a dermatologist. So I would say, apart from I'm not even worried about the harm factor, but more that lost time, because the earlier you intervene with all these conditions, the better you have at regrowth of hair, the better you have in vitiligo getting the pigmentation back. So I would say leave it to the professionals with that. In saying with hair loss, let's say if it's female pattern or male pattern, the generic kind of thinning of the hair, there have been studies to show that a bit of microneedling and something called PRP, where we take your growth factors from your platelets and inject that back to your scalp, that has been shown to improve things. But the idea is we've also got a simple, safe tablet that can also grow your hair back. So would you not want your client to get the right assessment first and then work out that medical therapy also? And also there are 60 different hair conditions, so how are you going to get the right diagnosis? And that's the most important thing. Certainly for the client who would like to try something non-invasive or is scared of doctors, there are a lot of us who just don't want to go down that whole doctor pathway for a non-dangerous skin condition. I think if you trust your therapist and they've got some experience, it's no harm, but you wouldn't want to waste that precious time, I think.
Yeah, just because you have the tools doesn't mean you should do it. I think that's a message I need to give to everyone. And it's always the practitioner behind the tools. You need to have the know-how and the other tools that go with it, like you said, tablets, medication, things that, okay, maybe the needling's not doing everything on its own. Maybe it's a combination of, as we said, combination treatments are best, combination of skin needling plus medications and plus seeing someone that's, well equipped like yourself. So just because you have the tools doesn't mean you should always attempt it.
No, and I think it's very powerful, to the client when you go, you know what, I'm actually going to refer you on because I trust this person to do the right thing for you. I think you end up keeping that client for life. I get so many referrals from estheticians, beauty therapists, other dermatologists, GPs, and there is that almost that care factor when you go, let's do this combined care, or let's get an opinion. I think it's very powerful. People feel because I'll refer on to fellow plastic surgeons or dermatologists or other kind of specialists if I need my patient having a different part of care that I'm not doing the best in. My philosophy is you do what you do to the best of his ability, but once it's outside your scope, there is humility and power in referring on.
Absolutely. And I think that's a really powerful message, because we do have a lot of therapists that are in this mindset still of you don't refer on, you're losing business, you don't refer on, whereas it will actually do the complete opposite. It will actually instill this sense of care and trust, and I want the best for you rather than I want what's going to suit me, which is not helping your client at all, really.
I think that's something that just having it seen and done so many years, I'm convinced that if you do the right thing by someone, they will always be thankful and you will kind of have them for life.
Yeah, I absolutely agree with that message. So everyone, listen up. Start referring. Now, one thing that you focus on in particular, and we kind of touched on before with obviously things changing as time goes by, is something called period skincare. Now, we're not talking about any kind of art piece where someone's using their menstrual cycle as skincare, which, I don't put it past people, but more that your skincare routine changes and adapts as we go through our menstrual cycle and obviously different hormonal periods. What exactly is a period skincare regime? What should women be doing during that time? What are your recommendations?
I guess I start with, it's nice to have a consistent skincare that you should be doing throughout the whole month. I'm a big fan of, vitamin B3, which will decongest your pores. It's anti-inflammatory. It helps build your skin barrier. vitamin C because it's also an anti-inflammatory, it helps with pigmentation, and then a retinol at night. So those are kind of things that I would say are non-negotiable for luminous skin. So period skincare, or it really addresses that flare that women tend to have just premenstrually or around the time of your period. So that we think correlates to maybe a bit more congestion, you're producing more sebum because as your estrogen levels drop, estrogen tends to suppress your sebum production, whereas progesterone, which tends to go up higher during the second half of your cycle, makes you more oily. So the idea would be that if you're getting that definite hormonal flare, I would suggest using something like the AHAs and BHAs a bit more regularly. You might find that if you're not too dry, you can introduce that every night on top of your retinol. But if you think, oh, I just need it a couple of times a week during that premenstrual flare, that's when you would use that proactively. So something like a lactic acid or a malic acid or a pyruvate acid, you would use that, kind of 5 days before you break out and for that week of your period. So it's kind of being proactive according to your flares, but there are things that you would do all the time. The other tip I always have is your skin can sometimes be a bit more sensitive around your period. Most people get a bit, it's weird, you produce more oil in the T-zone area, but then you're drier and just a bit more crepey during your cycle. So that's when I would say use a more hydrating cleanser, something that's ceramide rich, so that you're not overstripping your skin barrier. You would definitely, reducing the hot showers, no exfoliation during that time so that your skin barrier is more robust. But essentially it's nice to track when you might get flares and then improvise, but certain things you want to be just consistent throughout the month.
Yeah, I think that's wonderful advice, because a lot of us have our tried and true skincare regime, and it's very hard for us to break away from that. And sometimes it's very hard for our clients to break away from that. And I think everyone knows that pimple they get on their chin or their forehead or their cheek or wherever it might be during their menstrual cycle. And it's every single time. You don't know how to get on top of it. So again, sometimes it's little changes as something's coming. Preventative's always better than a cure, just to get on top of that before it happens. And for obviously treating clients in clinic, if we're getting on top of things like breakouts before they happen, it means less treatment, less PIH, less issues that we have to try to get on top of later, which is awesome.
I know. I say, like, even the spot treatment with Benzac, when you have an acne flare, nothing beats doing that 5-day kind of intense routine before, even if it means no alcohol that 5 days, or sleeping a bit earlier, as you've talked about. So programming your epigenetics, as we say, controlling your environment so that you're not getting that flare is powerful.
Yeah, absolutely. Think of it almost like an important meeting the next day. It's like, no, it's the week before my menstrual cycle. I'm going to go to bed early.
No, and I've got complete sympathy. Like, my nurses were laughing at me today because, I've been very lucky. I am a dermatologist. I don't think I've had a pimple in 10 years, maybe. Wow. I know, 10, 12 years. And I got my first one. You can see it on the Zoom thing here. It was huge. It just came out, it's got the perfect storm of a bit of stress, too much Netflix, and then a bit of that period. And it was so sore. And I was, doing everything not to squeeze it, but I really had to squeeze it. And I was like, oh my God, I've not felt this feeling in forever. And thank goodness, being a dermatologist, called in a favor with another fellow derm, and she just injected it for me with some cortisone. And I feel like 100 times better. But that's another good tip. If you get a really massive whopper, see your derm, and you can get a bit of a triamcinolone or steroid injection, which can be life-changing.
Yeah, sometimes you just need that real blast, especially if you're not someone that gets them often.
I know.
And I find COVID, everyone I speak to, I went over to a girlfriend's before lockdown. We try to do dinner every week, and she had a massive one on her forehead, and she's like, she never gets a pimple and she never breaks out. And she's like, what is this? I feel like it's just, again, candy, Netflix, lockdown, stress. It's the time for it.
Yes.
After the break, Lashana asked Shyamalar about treatment tools and skin mistakes. But first, a word from today's beauty partner. If you're looking to gain total skin wellness, then look no further than Murad. Murad is all about inclusive skin health, delivering clinical results via a fully customizable capsule collection of professional treatments and a comprehensive range of retail products. Dr. Murad, a dermatologist, pharmacist, and founder of the Murad brand, believes in science-backed professional skincare treatments combined with a total wellness approach. Simply put, Murad transforms skin through their products and their philosophies. Skincare, healthcare, self-care. If you're serious about skin, contact info@murad.com.au and beauty industry listeners will receive 50% off their first professional order of $500 or more, which is absolutely incredible. If you want to know more, start your skin wellness journey at murad.com.au. Thank you so much to the team at Murad Skincare Australia for making this episode of the Beauty Industry Podcast possible. And now, back to Lashana and Shyamalar.
Now, speaking of things that have come into fashion, the jawline is something that has come into the spotlight across the last few years. My background is actually with aesthetic technology and fat freezing, and everyone used to always want to do fat cavitation on their jaw. And now, obviously, we're seeing the jade rollers and the massaging and the sculpting facials. With dermatology, what do you feel is the best way to combat an area like that? Should we be referring on to a dermatologist? Are there other ways that we can help combat that lower face sagging and that double chin?
So, I like to analyze the face in thirds, like the first part, all the way from your forehead to your eyebrows, the second mid half, your cheeks, and then that lower third. That lower third aging is so multifactorial. It might be that little pouch of double chin that you were talking about right underneath your chin. It might be a bit of skin laxity that on the lower jawline, and that's why you've got the heavier marionettes, that kind of sad look. It could be a bit of muscle tone that's been lost. And then you can also get fat deposition on the jawline. So I think actually the proper analysis to work out what's causing your lower third deficiency is gold. But if you're trying to say that it's just a double chin, I tell my patients, lose 2 kilos of weight. Start that first, because that is powerful. And my biggest tip would be to do that with intermittent fasting, or slightly longer fast where you fast for about 14 hours. That seems to really help with that kind of stubborn, trapped fat areas. You would do that first, and then you can choose your modality of fat lipolysis, So if I quite like the Cutera device, the True Sculpt ID, where you get the radio frequency, melting that pocket of fat. You could also have ultrasound energy with the Ultraformer that can do that double chin melting. I used to love the injections where you can dissolve the fat in the area, but it probably, no one wants to put up with 2 to 3 months of swelling and that pain when you can actually just use modalities to reduce that. I also like contouring of the facial muscles. So that's probably where gua sha and even LED help. They're not as wow as these technology devices, which actually give you a permanent fat ablation. So, with all these radio frequency, ultrasound, you're looking at a good 20 to 30% permanent ablation, and you can't beat that really. But these facial therapies using gua sha and lymphatic drainage, they do kind of help the circulation. They give your skin luminosity, and you do get that temporary lifting, I think. So that's something that could be tried. Certainly if it's loss of volume or skin laxity, we can use dermal fillers. They also kind of contour the jawline pretty well. Depends, if you've got platysma, which are these neck muscles that really kind of give you thick cords and you're pulling everything down. An anti-wrinkle injection will also help with that. So I like that. Once again, you know me, I just love this pronged approach, because you want to have that thought process to working out how this person's going to benefit from what treatment. But back to your point, I don't see there's any any kind of stumbling block to an esthetician who's confident in double chin fat melting, if that's the major cause of that loss of contour, to try that first. Certainly no harm.
Absolutely. And I love that answer, because I think, and I throw everyone in the same basket, and I certainly don't mean to, but there is a big group out there that think one size fits all. And they think, oh, my client's got laxity here or a bit of a double chin, I must turn to fat freezing or cryolipolysis or radiofrequency, HIFU, whatever it might be, to address that, when really, as you said, it could be, those platysma muscles pulling down. It could be a loss of volume from the cheeks that's just all billowing there, and there's not so much that, gua sha or massaging is going to do to lift it back up if someone's in their 50s, 60s, etc. And it's a loss of volume rather than an accumulation of fat. So definitely it is a matter of obviously assessing the face. I'm very hands-on in pinching and moving and trying to see what moves where when I touch it. Don't be afraid to do that. And if you are stuck, again, refer on, get a colleague's opinion. But I think it's important, as you said, to assess the face maybe in thirds, maybe in halves, depending on your confidence level, and just know that one size doesn't always fit all.
Because, sometimes people run into trouble where they melt that double chin they think is obvious, but then they haven't addressed the skin laxity that now ensues once the fat is gone. So then you've got a turkey neck instead of something that's a bit fuller and more lifted or turgid. So very tricky. I reckon part of what I would say is an education piece to all my clients and patients is get yourself involved, get yourself excited about the consult process. I feel like in the world of aesthetics, that's almost just like a quick thing. You just throw it in, you're going to reclaim it back with your fees. I see a lot of, I think, beauty therapists and estheticians who feel compelled to almost throw it in as a free thing, when I think my message to you all is own it. Take the time, have that chat, because that is the most important thing. In life, I tell my nurses and, trainee dermatologists, like when you talk about the treatment plan, you talk about the side effects. Something is a side effect if you've talked to them about it. When it happens later on and it's a true side effect, if you don't mention it earlier in your consult, it's negligence. So it's perception. I feel like we all as an industry need to go back into the analysis. Yes, we've got all these fancy tools, and don't get me wrong, I'm obsessed about all my tools, but the magic really is that consult, that therapeutic conversation. You make that connection, you really get to know the person, but you really get to know the person's skin anatomy, how things are going to fit in. And I love what you said. I am going around all angles. I like to walk around them. I love the way you said, like, touch it, feel it, what is actually the texture of the skin, and that's going to put you in good stead.
I love you. You're singing a tune I've been singing for a long time. Again, my background is with doctors, working alongside doctors and seeing how they consult, which is where I've picked up a lot of my consultation techniques. So I've been in a very, very lucky situation where I've been able to be a fly on the wall and kind of pick that up. But I completely agree with you. You need to get excited. You need to get in there. You need to touch your patient. You need to give them a mirror. You need to spend the time. It's not just, how many cups of coffee do you drink? Yep. Okay. Move on. It's you need to get excited. This person has come to you. They're new. They're fresh. They're opening their heart to you, and obviously bearing what makes them the most self-conscious to you. Get excited. Get into a rhythm. Spend the time with them. Even with things, as I say, simple as hair removal. I say simple mostly because it's so flooded in the industry now. But I would have some of my therapists, when I was managing a clinic, do a full consultation just because they were doing the A to Z that they would normally do. Get the client on the bed, lift their pants up and go, oh, you've got blonde hair. Oops. And it's like, no, you need to get in there. Show me your hair. Show me. It should be a really hands-on and collaborative experience. And you're right.
Dynamic.
You should get excited. Yes, absolutely.
That's it. You're not going to just go through your questionnaire and, do it. Like you go, oh, questions like, do you tend to scar? Don't just take a yes or no answer. If they say yes, oh, let me look at your scar. What's it like? Clock it in. Like, are you getting hypertrophic, thickened scar? Are you getting atrophic scar? Be involved. It's my biggest tip with dermatology is that constantly think that you're a detective because you're trying to pick for clues. And that really makes it quite fun,
Yeah. And again, your tools are only as good as the person behind them. And while tools are fabulous, like skin analyzing tools, et cetera, they don't and will never, I don't think the AI technology is ever going to really be as good as us looking at their skin, talking to them about their lifestyle and putting all those puzzle pieces together. Your tools are going to be a fabulous addition, but it's not going to solve everything for you. It's not going to do the job for you. So it has to be a dynamic effort.
Absolutely. Stretch the skin, and no artificial intelligence is going to tell you that, this person's biggest trigger for her rosacea is tomatoes. No tool's going to do that. So chat to your patient, your clients, get to know them, be nosy in the nicest kind of curious manner, I say.
Absolutely.
They're coming to you. I almost feel like as dermatologists, estheticians, beauty therapists, it's like people come to you and they're bearing their skin, which is, very personal, but also so public because it's an organ that we carry so obviously, but they're kind of coming at you and they want you to solve the problem. So, it's a privilege. So look at all the clues, I say you're so lucky you can actually see your offending agent right in front of you.
I agree. And you should make them feel excited for coming to you in your clinic. And if your clients aren't converting, that might be a reason as well. They're just not feeling that energy from you.
Yeah. But I think it's a hard position to be in. Like, not everybody's going to be a dermatologist or anything, but knowing that if we all work together, at least you all know that you've got people that can support you in a tertiary level, or so that you feel like you're part of a team. I think that makes it a bit more you don't feel, you can either be more brave in kind of being bold about certain diagnoses, or say, I think you should get a second opinion, and be comfortable knowing that your patient or client would get the right therapy eventually. But also that kind of owning the space. We need to constantly be keeping up with reading, going to conferences. But the most powerful thing is doing things where you can actually chat to other people that know a bit more, you're sharing your information, and then that makes you better. That kind of clinical chat is very, very, very good.
Absolutely. And that's at the heart of something that we do. We obviously have our community. If you're unsure, your home salon, maybe you work by yourself as a sole trader, put it out there, get some opinions, get some advice, approach your local GPs, dermatologists, nurses. You might have a cosmetic clinic down the road. Work collaboratively with them. I couldn't even say collaboratively then. Work collaboratively with them, just so that you can get the best outcome. And again, it will give you someone to lean on if you ever get stuck, and kind of keep that accountability and that excitement there for you as well.
Because you're also learning, you see, like you learn next time you see your client, you go, oh, that's what she did. And that's what she diagnosed. Next time I see it, I know what to do. So you use your clients for you to grow, because we have to be honest, like humans, if we get bored or we don't keep growing, we're not going to be invested in this long term. So
no way.
It's the most perfect avenue to keep growing.
Especially when our industry keeps growing as well. You've got to keep up. You've got to keep finding that information and keep learning. And something you said there, which again is a song I've been singing for a very long time, is follow your client journey. It's part of that detective work. You're not going to know everything straight off the bat, but if you start going, all right, let's do some needling on this person, and you go, hey, that really worked. I'm going to do that next time for this. You learn and grow from your clients and from experiences.
Absolutely.
Absolutely. What is your most popular treatment to perform as a dermatologist?
Ooh, I use quite a few different lasers, but I would say, something that always is very rewarding is the vascular lasers or the BBL treatments for redness and rosacea. I love also doing all the macular seborrheic keratoses, these little age spots and pigmentation with the pico laser. So I would say redness and pigment issues and dyschromia, where you get that mottled look, is where I enjoy doing, and I love the results that come from it.
I don't blame you. They're very satisfying treatments to perform.
I know, and you get that real wow factor very quickly.
Yes.
So that and the patients almost immediately, once that canvas becomes clearer, they're happy, very happy individuals.
Nothing more satisfying than seeing pigment crust.
Oh, I know.
If I see someone walk through, because obviously we don't deal with, actinic keratosis or solar keratosis, we deal with more freckles. But anytime I would have someone freckly come in, I'm like, yes.
I know. It's like almost like magic, isn't it? Just like peels off in the next few days.
Oh, it's so good. So good. I did a girlfriend. She's Irish background, very, very fair, black freckles. Oh, she was a dream to treat. She was just, it all fell away, the poor thing. She had to sit at reception. Yeah. Oh, no, she looked amazing because obviously she's so pale under there and it's so beautiful. But the poor thing had to sit there with these black crusting freckles at reception for a good week. So sorry, Emma, it was worth it. But it's very fun. I don't blame you for loving those treatments. You get a lot of bang for your buck.
And actually what I think is going to change is the whole body contouring thing, because with the technology that's out there for, permanent fat loss with radio frequency or muscle building with electrical stimulation, I think that will become one of my more popular things because you actually see that body transformation.
Yeah.
So, yes.
It ties in well with, obviously, everyone's starting to now get on more of a health kick journey. We've seen gyms and group trainings grow exponentially. We've seen healthy eating and lifestyle grow exponentially. So I think that just ties in really, really well with that. And it's non-invasive. If you're using something like radio frequency, ultrasound fat cavitation, even things like cryolipolysis, they're fantastic ways to tie into what is popular at the moment.
Yes. And then when you have that holistic approach where you still do your cardio, you get your Vmax up, you're going to get the best of both worlds.
Absolutely. It's a prerequisite to doing a lot of those treatments, to be really honest.
Now, the other exciting thing would be, removing all our sun damage and freckles on our body, with, for example, Cyton's BBL hero technology. You can rejuvenate your whole body. I mean, I think that I never thought I would see as a dermatologist, so, why would you just stop anti-aging just on your face and neck and your hands? Why not anti-age your whole body?
Yes. Everyone always forgets about the body and the hands. I feel like everyone always concentrates on the face and they might not bring it down their neck or their chest or their hands. And it's always that telltale sign of how old someone is to look at the back of their hands and go,
I know, everyone ages differently too. Like, I personally feel my neck's my Achilles heel to it, or, I always feel like that's where I've aged the most. And so it's good to have a treatment option that can treat these kind of telltale signs.
Yeah, absolutely. I saw a video online the other day of a dermatologist saying, if everyone used sunscreen, I would be out of a job. He's kind of not wrong. We'd all be out of a job.
No, I think, sun damage, no brainer. It's about, 70% of all the damage done, but you got genetics and you got lifestyle. So I think your job's very secure.
Yeah. There's all these other things that we have to factor in. Now, skin therapists and dermatologists, we want to see them obviously working collaboratively to treat their patients. How can skin therapists start approaching dermatology? How can we start integrating that referral into our consultations and our treatments?
So I think, we need, skin therapists need to be proud that they do know a lot about the skin and they're genuinely interested in this field. So that's when I think the assessment is really important. If it's just low-level dyschromia, congestion, acne that you think you can do with, certain BBL light frequencies or pico, go for it. I think when you need to be very vigilant is when you think a freckle is not really quite a freckle. Anything that you remove, especially with pigmented stuff, my strongest kind of advocacy in this department is make sure you know what you're lasering off. Anything you feel a bit, listen to your gut too. When you go, oh, it's just a bit odd. When it's just a bit odd, especially if you've been working for a long time, if you know something's just a bit odd, listen to your gut and refer straight on. And I know no dermatologist who would go, you know what, we need to look at that freckle or that mole or a pink spot that's not quite a pink spot. It's not really behaving like a pimple. It's not behaving like a sunspot, like a solar keratosis. Refer on, because that's when we'll put our dermatoscope, our microscope on it and reassure the patient and say, you know what, go ahead, or let me just take that off and then you can do all the lasers around it. So my tip is be confident. Anything you don't know or think twice, refer on. It's just not worth that that kind of medical guilt, I think, that you might have done something wrong for that patient. But I mean, in the practices that I work, the skin therapist and the dermatologist work very closely in hand. I always say, wouldn't it be great if, dermatology is an apprenticeship. We all learn so much from other dermatologists throughout our life. But imagine if we got, some lucky skin therapists to shadow dermatologists. Even if you managed to shadow them for 1 month, you would learn so much. And just how we talk to patients, how we talk about a condition, looking at us perform treatments, you're going to learn so many things. But also when you might have just missed something because of the lack of knowledge, that's when I think it's really powerful to work hand in hand with a dermatologist. But essentially, we're on the same team. We just want our patients to look luminous. And there's a lot of things that we would delegate to our in-house skin therapists anyway. So I don't see a definite, demarcation of this can only be done by a dermatologist in terms of technology devices and this by a dermal therapist. But anything that breaks the skin, anything that's potentially going to give you scarring, if you're worried about pigmentation, why take that risk? Let someone else with maybe a medical background do it. But I see us working synergistically very well.
Absolutely. And as someone that's experienced it firsthand, I mean, I was with cosmetic physicians, not dermatologists, but I've experienced firsthand that you can actually work very harmoniously, very synergistically, and not only will it boost your knowledge as a skin therapist, sometimes it will go the other way. Sometimes you will find, doctors, dermatologists will go, what do you think we should do? And it's a bit of an ego boost, I won't lie. It does make you feel really, really good. But you're learning off one another. And as you said, we both want the same thing, which is we want our clients to be happy. We want them with healthy skin and we want them to look and feel fabulous. So how can we have this divide when we both want the same thing?
Yeah, and you're constantly learning. I mean, when I was a young dermatology registrar, as doctors, we also tend to we love to go intense hard. Like, we think downtimes are normal, like you're going to be swollen and scabby. That's part of it. It's coming to see a dermatologist. But what I was beginning to see was a lot of my skin therapists and dermal therapists were getting almost the same result at the end, but with very much less downtime, and that's kind of morphed my whole philosophy with how I treat the skin. I actually am very pro, I think you almost got to treat it or cook it just the right amount. Too much and it bears its ugly face, and too little and you're not going to get that end result. So I've learned from non-dermatologist all my life too. So I think you're very spot on about that collaborative approach.
Yeah, absolutely. And it does go back to having those tools and those things at your disposal. Sometimes, while yes, the hard-hitting treatments are fabulous, we forget that GPs, dermatologists, they've got things like Kligmans or hydroquinone, things that they can prep the skin with that are much stronger than what we use in clinic. So we do sometimes have to go slow and steady wins that race. And that's where working collaboratively works so well, because you can go, hey, we can do something a bit harder hitting because I know you're on XYZ product that's stronger from this dermatologist. So again, it's all about, we always come back to those combination treatments, and that's just because they're so effective. Working collaboratively and combining so many different tools and modalities is only ever going to lead to a better outcome.
Yeah, and I think on that point, like even if you're not working in the same clinic, it's to have each other's back. I think we, as a dermatologist, I will see maybe not so ideal outcomes from different clinics or skin therapists, but you don't then, unless it's something overtly bad, you don't then put them down. I think, I think having each other's back, because ultimately that person did it in good faith for the client on that journey, especially if they've referred them on, you know that someone's got your back. Same thing for me, like a lot of sometimes pharmacists, dermal therapists will go, oh, what? You're on this intense antibiotic that's going to kill your gut. You know what I mean? So I think it's all about how we all talk to clients. We don't want to alarm them that each person is doing something really wrong by them. So that kind of human tact, I think, needs to be worked on all departments. And you just align yourself with like-minded individuals, and then you create this little community that obviously you're doing so well in. And I think, you got something great going there.
Absolutely. Absolutely. On that note, what's the biggest mistake you see?
Oh, I see lots of mistakes. Well, I think something even basic, like, people are washing their face with like hot water in the shower, especially in winter, a little bit of a face scrub, too much exfoliation. And you think, oh, how can that be that bad? But it's that cumulative damage that you do to your microbiome, your skin barrier, that then gives you a bit of rosacea, eczema, and then you sensitize yourself to a product that you shouldn't actually be sensitive to. So it's those little mistakes that can actually become huge mistakes. Other things I see, particularly with hair loss, because that's what I also manage a lot of, is people delaying the diagnosis. And that can be, we put it off to just, maybe it's just a one-off. But when your hair thins out, when you're getting that excessive shedding for a while, don't wait, I think. And the other thing is knowledge about, we think that hair, you can't grow it back. Like skin, we can almost fix it, but most people don't realize that with hair and nails, dermatologists can actually really help you and change things in a very cost minimal, safe way.
Yeah,
so that's absolutely what I see too. My other little thing I always think about is, people will come in and want to have anti-aging or improve their volume loss to their face because they want to age better, but they haven't looked at the whole picture. How there's no point looking young on your face if your hair is so thin, or if your neck is really old. I think look at that holistic picture. Make sure your diet and your lifestyle and your gut health is actually really optimum before you in fact do the other onboarding skin therapy. That's another mistake I feel, because you need to kind of empower yourself to fix your inside simultaneously, or at least before we do the outside.
Absolutely. If anyone wants to kind of have a look at how much extrinsic or external factors affect the skin, and you probably know of this study as well, where they looked at biologically identical twins, and one had a much better lifestyle than the other, and then they compared their amount of aging, their sun damage, how their skin was looking, and oh my God, what a difference between some of them. Because biologically they have the same genetics. They should age intrinsically at the same speed and at the same rate. But obviously if one is a heavy smoker, avid drinker, is in the sun all the time, sun damage, it's going to accelerate their aging quite a bit. And you're right, you will be constantly chasing your tail if you don't address some of those external, or, if it's gut related or health related internal factors, you're just going to be chasing your tail around and around and around. So really, really important that you look at everything. And again, that's where referring on comes in. And another point I wanted to make that just popped in my head when you said the neck was everyone just Google a picture of Helen Mirren. Like, honestly, people always go, oh my God, how does she look so young? And I'm like, it's her neck. It's her neck. Her neck looks fabulous. She's had a neck lift or something. I don't know what, but that's why she looks fabulous.
I know, neck, I mean, that's my pet thing. But yeah, neck aging, wow. That.
It can make a difference.
Make a huge difference, neck and hands, I reckon, and chest.
Yes, chest. It's always funny to me when I see these ladies that come in that have these beautiful faces and then this salt and pepper neck and décolletage. And all I want to do is take a laser to it.
Actually, talking about mistakes with the neck, you know, a lot of us get that mottled, reddy, brown pigmentation on our neck and our chest, and it can be just sun damage. But a lot of times it's this condition called
poikiloderma. Yeah.
You know, in fact, photosensitizing fragrances, you know, reed sticks, candles, and then you get that sticking on your skin, and then you get exposed to the sun, which gives you that pigmentation. So we should always tell our young women, don't use fragrances to that area.
On the neck, no.
You know, and the chest.
The first question I used to ask when I'd see ladies with poikiloderma on the side of the neck, I'm like, where do you spray your perfume?
Yeah.
I'm like, is it just here? And they're like, yes. How did you know?
You're a detective.
Yeah. It's like on the clothes, people, on the clothes. I have to ask you before we wrap up today. I mean, someone that hasn't had a pimple until now for 10 years.
Very stressful. Go on.
Oh, and plus, I mean, mask, COVID, you know, that whole shebang, it's inevitable. What is the one product or treatment that you can't live without? What's your go-to?
Oh, it's very hard asking someone who's got access to so much. I would say the right skincare, you know, like that's probably the biggest nourisher of your skin cells, apart from your internal well-being. So I would say the right skincare regimen for you starting early. It's going to be something that you indulge in long term, and that's probably the most powerful thing, because once your skin is viable, healthy, luminous, you look beautiful. And then I think technologies come in for particular areas.
Yeah, what a great piece of advice. I love that, because it's really a trick question, because you're right, there's not just one thing. It's really a balance, and 70% is always skincare. So if you can get that balance right and start early, usually on top of everything, and preventative's always better than a cure.
Yeah, and you know, you can have all the dermal fillers, anti-wrinkle injections, lasers, but if you don't have the right skincare and lifestyle, you're never going to keep it long term. But also I call it the look where you look done, but you're not looking supple and luminous. You know, in the ideal world, you would do it all. And that's why you'd see a professional to stagger it at the right time for you. But skincare is like, you know, watering your garden. You need that spot on.
If you don't do that, you end up looking like an alien, because you're tight but sun damaged and not luminous, and mentally, when you look at someone, it doesn't make any sense.
I know, it's almost they look dysmorphic, isn't it? Like they look just a bit odd. Yeah, I mean, I'm a big believer that, you know, minimalist skincare, or like just our skin is very good at rejuvenating so long as we feed it the right ingredients. So we have that natural potential to heal. We've got beautiful stem cells, and we just need to nourish it, whether it would be laser technology or skincare. But if I had to choose one thing that you could do consistently that's not going to break the bank and ultimately give you the best result, I would say it's skincare.
I couldn't agree with you more. Absolutely. Well, I need to wrap up. I could probably chat to you until the cows come home, because you're just saying so many amazing things that I think our community are going to get so excited about.
No, thank you for having me. It's always fun, and it's just good to share ideas, thoughts, and I like this whole kind of informal, but yet it's very powerful nuggets that we're kind of bringing out in each other. So well done you.
Oh, thank you. And it's been such a pleasure. Rug up. It's another cold Melbourne week this week. So I'll let you go get into your nice snugglies and enjoy your night.
You too. Take care.
Thank you.
Well, I don't know about you, but listening to today's conversation was like having a chat with a best friend who knows everything and more about the skin. What a treat. I certainly know how much information I've loved and learnt by tuning in today, and I hope you did too. And if you'd like to see more or even hear more about Dr. Shyamalar, you can take a look over at her clinic, ODE Dermatology, or by following them on the gram at ODE Dermatology. Appreciate your time and your ears for listening along today. Please feel free to leave us a review in your podcast app if you enjoyed the episode, and remember to click that subscribe or follow button over in your podcast app to keep up to date when new episodes drop on Mondays and Wednesdays. Until next time, stay connected.